So in this video we're going to be looking at some exercises which will help you if you have a trapped nerve. So the first exercise we're going to do are have 3 stages. They're called Mackenzie neck exercises. So the first exercise is simply, again, sitting up nice and tall, nice and wide, and you're going to be gently tucking your chin into your throat. Again, trying to create a nice long neck. If that's okay, and you're not feeling too uncomfortable, what you're going to do is you're going to hold it with that nice long neck, and then you're going to try and look up. So you're doing 10 repetitions of these, a rate of about sort of holding every kind of couple of seconds. If that's still okay, it's not causing you too much discomfort, what we're going to do is when you've brought the head up, you're going to tilt the head slightly to the left and then tilt the head slightly to the right. Again, you can do those for 10 repetitions for each side. Now what we're going to do is we're going to look at exercises for specifically for the pain going down the arm. So depending on where it goes down the arm depends on which exercise you do. So the first exercise we're going to do is for the median nerve. So the median nerve, you'll get your symptoms going more down the outside of the arm into the thumb and first finger. So your symptoms tend to be pins and needles, some numbness. You might even experience some weakness in the fingers and the hand. So to do the median nerve mobilization, first of all start off with your palm up, okay, and then you're going to extend the elbow, and you're going to bring the fingers down towards the floor, okay. So that might be plenty enough there. If you want to go a bit further, bring the arm back, okay, and then to maximize the stretch on it, you pull your head up, you bring your ear towards the opposite shoulder, and then to do the mobilization, what you're going to do is bring the head back towards the affected arm. Now take some of the tension out of it, and then to create the mobilization, we're going to bring the hand up and bring the head away at the same time. And again, hand down, head towards, reaching right down to the floor, and then bring it back up and the head away, whilst we're kind of focusing still towards the horizon. So we're not rotating the head, we're dropping the head sideways. Okay, so that's for your median nerve. I do that, I do 10 repetitions of those, and again I do those several times a day. If your discomfort runs more down the inside of the arm and into the 4th and 5th finger, this is your ulnar nerve. To mobilize your ulnar nerve, we start off with your hand palm face up again. And this time what we're going to be doing is we're going to be turning the fingers to face backwards. Okay, that might be enough to start off with. If you want to go further, you're going to turn the fingers inwards, okay, to face the head, and then you're going to, if you want to go further, you're going to bring the fingers down and the elbow up, so that you're almost coming to cup around the ear, and that you should feel quite a strong stretch onto that. If you want to go a little bit further to stretch it, you bring the head away towards the opposite shoulder. And again, to do the mobilization, what you do is just relax the tension and drop the head towards the arm, the involved arm. And again, bring the fingers down and away. Okay, so that's the ulnar nerve affecting the 4th and 5th fingers particularly. So for the radial nerve, which particularly affects the back of the arm and the back of the hand, what you're going to do is you're going to start off with your arm out by the side. You're going to point your fingers backwards. In fact, that might be plenty. You might get enough stretch on that already. And then if you want to go further, what you do is you point your fingers outwards. If you want to go any further than that, you start pointing your fingers up towards the ceiling and bringing the arm up. Okay, to create a bit more stretch on that again, you can bring your head away. And then to create the mobilization, relax the hand, drop the head towards again. Or a variation of that, you may just extend the elbow and relax the elbow rather than moving the head. Okay, so those are your mobilizations for a pinched nerve in the neck. I hope you get on with those. Any questions, please do ask.